We cannot finish this chapter without telling or saying where are these cells produced? Where do they come from? And I hope you are all screaming at the same time, bone marrow, bone marrow. We described that in chapter 4 or 6 that when we were describing bones. Remember we described the medullary cavity and the spongy bone, and in between, in grown-ups, adults, the bone marrow, the red bone marrow, is located on the spongy bone in the actual skeleton. And here you can see the vertebrae right here in the spongy bone, in between the trabecula of the spongy bone of the actual skeleton. And in the pendicular skeleton, we also have red bone marrow in the bones of the pectoral and pelvic girdle, and only in the proximal epiphysis of the humerus and the femur. Those are the locations of red bone marrow in the adult. In the rest of the bones, in the medullary cavity and distal epiphysis, what is located, what we find now, is yellow bone marrow. So if you remember, red bone marrow is where blood cells are produced, and yellow bone marrow is filled with fat tissue. It's like a dormant stage of bone marrow. Now, all the blood cells, they all derived from mama cell. And this mama cell is a stem cell. And we are going to describe each of these cells and memorize. I'm kidding, guys. The only thing that I want you to keep in mind is that from one cell derives every single line of cells, or every cell that we have described on blood. So there's different lines. There is one line of cell that produces red blood cells. There is a second line of cells that produces all the granulocytes, basophils, eosinophils, and neutrophils. Then an individual line of cells for lymphocytes, another line of cells for monocytes, and another line of cells for platelets. I told you I was going to show you the megakaryocyte. You see how enormous, gigantic, and huge these cells is? So just pieces, fragments of these cells form the platelets. Cool, right? Now, what is important of this to keep in mind is that all of these production of blood cells, all of these events happen on the red blood marrow. What is sounding? Red bone marrow. Now, on the latest stages, these immature forms, before they reach the mature red blood cells, the mature basophil, eosinophil, we have immature cells before that. On that stage, usually some of them, just less than between 1-2% of our blood cells, are immature cells. They are released into circulation as immature cells. For example, red blood cells are released as reticulocytes. And reticulocytes have still the nucleus and have some ribosomes and maybe a rough endoplasmic reticulum. But within 1-2 days, it ejects the nucleus, ejects all the organelles that have left in the cytoplasm, and becomes a mature red blood cell, ready to perform its function. And a red blood cell lasts about 120 days. That's the average of the lifespan of a red blood cell. The white blood cells are released usually, or at least 1-2% of these white blood cells are released as band cells, and these are immature forms of granulocytes. So these can be used as an indicator of infection. If we have an infection, let's say that we have a bacterial infection and we need more neutrophils to fight that infection. Bone marrow is going to be stimulated to produce and release faster neutrophils. It doesn't matter if they're young cells, if they're immature cells, if still they're going to release all of those cells that are needed in the site of infection. So when you measure the blood cells in when you ask for a blood count and you measure all of these, each of these white blood cells, they're going to tell you where there's some bands. There's 1-2% of bands. A number above that percentage, well, you start thinking there might be an infection around. So that's the application of this knowledge. Now, look at that, another smear. So now that we have described all the type of blood cells, let's see if we're able to identify them. Well, first of all, is that something catches your attention in here? Well, this might be a Photoshop because one, there's little red blood cells in there unless this guy has anemia. And there's a lot of white blood cells. I mean, you should be, maybe you have the same chances of winning the lottery than having the 5 types of white cells in the same visual field under the microscope. Okay, so let's identify them. See, and we're grouped. We have the granulocytes in this side and the agranulocyte in this side. So these are the neutral granules, neutrophils, the ones with the red granules, the eosinophils, and the blue granules, BB, blue basophils. And then the agranulocytes, remember the avocado is the lymphocyte, and the gigantic monocyte with the kidney-shaped nucleus. And see, we only have one platelet. Now, we don't have that little, just one platelet in there. Thing is that when you get, and you're going to be able now, we're going to do that activity in class. In our class discussion, when you get a CBC, you're going to get the number, and you have the absolute number, you know the absolute number, you know the percentage of each cell. And you don't need to memorize it. They always give you the range because it can vary a little bit from lab to lab. So you can analyze the number of erythrocytes. You can see if it's within the normal range, the number of leukocytes, and the differential count, which means they're going to tell you, if you ask for a differential, they're going to tell you the number of leukocytes and the number of percentage of each type of leukocyte. And the same thing, they're going to give you the number of platelets. So this is how it looks like. This is a CBC. So they're telling you here, this is white blood cells. In here it has 2,100 cells. If you remember, well, here you have your range. For this lab, is between 4,000 and 12,000 cells per cubic milliliter. So you can see there is below range, he has leukopenia. So you add the suffix penia or emia or enia when you're lacking, you have less than you're supposed to have. Okay, so he has leukopenia. Why? Let's discuss that in class. He has anemia. See, he has the red blood cells are under 4 millions, and hemoglobin that we said is around 13, 14 grams per deciliter, and here is 6. So he has anemia. And look at the platelets. Do they give you okay. The platelets is 72,000. It has to be at least 150,000. So we have thrombocytopenia, anemia, and leukopenia. And when you see the differential, we have the differential in here. Yes, we do. You can also analyze the values of each of the neutrophils, each of the white blood cell, to see if you have apenia or a philia. So usually this is for red blood cells, polycythemia, above the increased number of red blood cells, decreased number anemia, leukocytosis above normal range, leukopenia below, and so forth. Okay, so we're able to use this number. So for example, no, I'm not going to give you the example because you're going to figure depending, for example, in here, platelets. He has every 2,000 platelets instead of 150,000. So, what do you think this patient is going to look like? He's going to be pale and tired and sleepy, and maybe the heart rate is increased all the time. He has tachycardia because he's anemic, but he also has a tendency to bleed. Maybe when he goes to the bathroom, he uh, to do number two, he bleeds. When he's brushing his teeth, he bleeds. If he bumps against the table, he's gonna have a huge bruise in there because he has he lacks the minimum number of platelets to avoid bleeding. White blood cells, this guy is prone to infections. What type of infection? Well, you will figure it out in here. Okay, so that's how we're going to apply this knowledge about the blood components to practice. Okay, so see you in the class. We're going to discuss these concepts. I hope you enjoyed this class and you didn't end like this. See you later, alligator.